Welcome everyone. We are Team 8 from the program Data Science for All Colombia. We are Diego, Sergio, Pedro, Julian, Angie, and Nicolas. We are going to use data science to analyze the factors affecting the prevalence and spread of influenza. Influenza is a virus that causes between 3 and 5 million cases of illness every year, and between 250,000 and 500,000 of deaths every year. People of 65 years or older are the most affected, but also children and adults face complications. Our sources consist from datasets from the World Health Organization and the World Bank containing the registry of influenza cases, health indicators, mortalities, and economic factors per country and per year during 2000 and 2015. We can see that the influenza activity was very high during 2009. This is due to the swine flu pandemic. We analyze what are those factors that affect the influenza regarding health and hygiene. For example, the access to clean water services. We notice that there are a high concentration of cases around the Africa region. Also, the access to hand washing and sanitation services and facilities. As we see, Africa performs poorly in providing good hand washing services to the population. This affects both the number of cases and the mortality rate of this disease. Also, the access to medical services and the number of doctors available per 1,000 people. We see that there is a lot of concentration of cases around countries with low percentage. We also found that tourism and travel habits affect the spread of this disease. We found a positive correlation between the number of influenza cases and the number of tourists around every country in every continent. So it is important now that we can do an analysis of how these factors are affecting the influenza across all the regions. For example, the air quality, the unemployment rate, the gross domestic product, and the number of hospital beds are also affecting the spread of this disease. If we look at the total number of influenza cases per country, we see that the USA has the biggest amount of infected people. However, when we normalize by the population size on each country, Europe was the worst region. We can also look at the mortality rate across all the continents, and we can see that in Africa, the mortality rate of influenza was very high and different from other regions. We use data science to find out what are those variables that have the most impact on the number of influenza cases. We implement a regression model with the following variables: the health expenditure, the number of tourists, the gross domestic product, and then unemployment. This model has a 0.34 R-squared value and has a good prediction. However, there are still variables that we might consider or use in a different technique. For example, in this second model, we use the year as an extra variable, and we remove the unemployment rate. In this model, we can see that we have a better adjustment and prediction for our model, with an R-squared value of 0.55. This picture shows that the prediction on influenza cases have improved. The conclusions of our study are that the number of physicians available for the population and the percentage of people that has been immunized has an inverse effect on the number of infections. Also, using our models, we can see that 1% increase in gross domestic product increases the number of influenza cases per million in 0.53%. Also, we saw that the number of tourists and arrivals flights increases the number of influenza cases. Thank you for your attention.